an act to amend the Protection of Plant Genetic Resources for Food and Agricultural Act 2018 will be read a second time. This seeks to amend the original act to provide for the integration of the functions of management authority in the ministry responsible for agriculture, in keeping with the government's thrust to rationalize public bodies. Also under public business, Pensions, Superannuation Funds and Retirement Schemes Investment Amendment Regulations 2019 resolution will also be taken. Under private members' motions, debate is to be continued on private members' motion number 43, that a cap be set on the amount that can be transferred from the Capital Development Fund to the Consolidated Fund, so that meaningful infrastructure works can begin in the constituency after waiting for 40 years, the restoration of the bauxite levy, and that there be extensive rehabilitation of bauxite lands, and that these lands be returned to the farmers, and the concerns regarding bauxite mining operations in the parishes so affected. Also on the private members' motions, debate is to be continued on private members' motion number 72, that the Honourable House recommend that the Port Antonio Square be renamed Nanny Square, that a statue be erected in that square in her honour, and that any necessary attendant infrastructural and other modifications to said square be undertaken and completed to reflect our high regard and respect for her status, and that the passage between breastworks in Port Antonio and Nanny Falls be named the Nanny Trail, with all attendant issues arising from this change completed in a manner befitting her status as our sole national heroine. It should be noted that the agenda can be adjusted with items being added, removed, or replaced. If you are planning to attend a session at Gordon House, here are some rules you need to keep in mind. No visitor shall create any act of disorder within the precincts of the house. No visitor shall be admitted to the house without first obtaining an admission card. Visitors who remain within the precincts of the house during a suspension of the session are asked to keep silent. It's about time to go over to the proceeding, but first, the answer to our Parliament trivia. We asked, the Jamaican Parliament has its history in the House of Assembly that first met on January 20, 1664 in Spanish Town. Is this true or false? It is indeed true. The Jamaican Parliament has its history in the House of Assembly that first met on January 20, 1664 in Spanish Town, then called St. Diego de la Vega. At that time, Spanish Town was the capital of Jamaica and the seat of the government. Now over to the proceedings.
All right.
Mr. Speaker, I need to draw your attention to certain breaches that have been happening in this House. I don't know if I need to inform or educate the new members, and maybe I need to remind the older members or the members who have been here long before. During prayers, once you walk through that door and it is closed on prayers, members do not enter the chamber. And constantly, while prayer is going on and while you are coming in, you have members opening that door to come in, or the other one over there. It must be established and understood that once the speaker comes through that door, wherever you are, you stay outside and the prayer is completed. You don't come through any of the doors. We need to go back to the principles of this House. And secondly, after prayer, or during prayers, we have discussions and loud talking. Once there's prayer, until the marshal places the mace on here, members are to stand in silence. So I do hope that we can go back to the whole principle and old days of the order of this House, and to stop that nonsense once and for all.
I want to thank you Minister, and I want to further express that I've been greatly concerned about members having discussions even before prayer or before the maze get in place. Remember walking out before the maze go through the door. We all are very experienced parliamentarians. Our problem is that we have a number of students who visit us, and they are supposed to take notes to take back to their schools as to the performance of parliamentarians. I want to thank you, Mr. Warmington. I hope that we all will abide by.
Mr. Speaker, I'd just like to extend to you my appreciation, well, not appreciation, but I'm happy to see you back with us. I saw a picture in the newspaper of you somewhere else, and I didn't know if I would see you today, but I'm happy that you are in your chair today.
Thank you very much, Mr. Robbins. Call statements by ministers.
Mr. Speaker, I would like to enjoin the sentiments expressed by the member from Southeast St. Andrew. We were all very concerned when we heard that you had fallen ill, but knowing you as long as I do, and with my involvement with you over these many years, I know it takes more than a cold to keep you down for very long. And I'm glad to see that you have rebounded vigorously, full of vim and vitality. So it's very nice to have you back in the seat. Mr. Speaker, it is intended to have a statement from the Minister of Health, but he has some. Yes, he has some copies to be printed, and you know the members of the opposition are forever insisting on every copy that they're entitled to. So we don't want to create any discomfort, so we will suspend his statement and enable you to proceed with the matters of the day. And I will come back to you when you reach notices of motion given orally. Thank you, Mr. Speaker.
Announcements.
Laid on the table of the House today are the following: Minister Paper number 8, the annual report and financial statements of the All-Island Jamaica Cane Farmers Association for the year ended September 30, 2016. Minister Paper number 9, entitled Cabinet Agenda Issues, dated December 17, 2019. Annual report of the University of Technology, Jamaica for the year April 1, 2015 to March 31, 2016. The Judicature Parish Court Rate of Interest on Judgment Debt Order 2019 and the Judicature Supreme Court Rate of Interest on Judgment Debts Order 2019. The Terrorism Prevention Designated Reporting Entity Attorneys at Law Order 2019 and the Terrorism Prevention Designated Reporting Entity Attorneys at Law Order Resolution 2019 under the Terrorism Prevention Act.
Members, I wish to bring to your attention that we have a number of students and teachers visiting with us today from the Montego Bay High School. And we have 35 such students and their teachers. From the Equality Youth Jamaica, from UTEC, we have the Urban and Regional Planning Program. 20 of their students are with us today. And from the University of the West Indies, the Elsa Leonie Ryan Hall Leadership Program. 20 such students are here to join us today. We wish to welcome you all and hope you have a fine day. You are permitted to take notes but not to communicate so that I can hear you. Thank you. Bills brought from the Senate. Petitions. Papers. Reports from committees. Notices of motions given orally.
Mr. Speaker, permission to speak from a seat other than my own.
Go ahead, Madam.
Thank you, Mr. Speaker. Mr. Speaker, I beg to give notice that at the next meeting of the House, I will move the following motion. The Terrorism Prevention Act, the Terrorism Prevention Designated Reporting Entity, Attorneys at Law, Order Resolution 2019. Whereas Section 15 of the Terrorism Prevention Act, hereinafter referred to as the Act, imposes reporting duties on certain entities, and whereas Section 15, subsection 2 of the Act provides that the Minister may designate any entity as an entity to which the provisions of Section 15 of the Act shall apply, and whereas Section 15, subsection 2 of the Act provides for the aforementioned designation to be made by order subject to affirmative resolution, and whereas on the 6th of February 2019, the Minister made the Terrorism Prevention Designated Reporting Entity Attorneys at Law Order 2019. Now, therefore, be it resolved by this Honourable House as follows. 1. This resolution may be cited as the Terrorism Prevention Designated Reporting Entity Attorneys at Law Order Resolution 2019. 2. The Terrorism Prevention Designated Reporting Entity Attorneys at Law Order 2019, which was laid on the table of the House on the 12th day of February 2019, is hereby affirmed.
Mr. Semudo.
Mr. Speaker, I beg to give notice that at the next meeting of the House, I will move the following motion. Whereas subsection 1G 1 of Section 41 of the Constitution of Jamaica requires a member of this Honourable House of Representatives to vacate his seat if any firm in which he is a partner or any company of which he is a director or manager becomes a party to any contract with the Government of Jamaica for or on account of the public service, or if he becomes a partner in a firm or a director of, or manager of a company which is a party to any such contract. And whereas the Member of Parliament for St. Catherine East Central is a partner in the law firm Terry Long Partners Attorney at Law, and this firm may from time to time enter into contracts with the Government of Jamaica and its agents. And whereas the member has disclosed his interest in this firm, be it resolved that this motion be referred to the Ethics Committee of the House of Representatives for consideration and report. Be it further resolved that the Judicature Supreme Court Rate of Interest on Judgment Debts Order 2019 under the Judicature Supreme Court Act, which was laid on the table of the House on the 12th day of February 2019, be referred to the Regulations Committee of the House of Representatives for consideration and report. Be it resolved that the Judicature Parish Court Rate of Interest on Judgment Debts Order 2019 under the Judicature Parish Court Act, which was laid on the table of the House on the 12th day of February 2019, be referred to the Regulations Committee of the House of Representatives for consideration and report. Mr. Speaker, I further beg to give notice that at a later stage today I will move for the suspension of the standing orders to enable me to take these motions.
Question.
Mr. Speaker.
Committee.
Mr. Speaker. Mr. Speaker.
Go ahead.
Mr.
Please.
Speaker, could you tell me if the Prime Minister will be answering the questions? My mic is on. Could you tell me if the Prime Minister will be answering the questions that are standing in my name today, sir? The ones that were due last week.
Mr. Speaker, the question has been asked, although we are not at questions and answers.
No,
the question.
he was. He just said it. He just said questions.
He said? Oh, you did? Oh, I'm sorry. Therefore, the fact is that there will be no answer to questions today. Not today.
Mr. Speaker, would the Leader of Government Business care to share when the Prime Minister will be answering those questions?
Mr. Speaker, I think it should be abundantly clear. I think it should be abundantly clear that the record of performance of this Honourable House with respect to the answers to questions is almost unequaled. We have only 2 questions that are due, 3 questions due for answer in this very February. In fact, quite frankly, yes. So, Mr. Speaker, we are not trying in any way to postpone unnecessarily the answers to the questions. The Prime Minister will respond to them in the appropriate time.
Mr. Speaker, I appreciate the honesty of the Leader of Government Business. The reason why I rose to my feet is because the Prime Minister, when I was questioning him last week, gave his assurances that he would have come this week to answer those questions. That is why I have got up to ask.
Mr. Speaker, Mr. Speaker, last week in the Parliament I tabled some questions which the Prime Minister had indicated he was not in a position to answer based on a non-disclosure agreement. I heard in the public domain that the Prime Minister was coming to Parliament today to provide answers to those questions. I'm seeking through you whether the Prime Minister intends to address those issues today.
Well, Mr. Robinson, I am sure that the person who should ask that question would be the Leader of Government Business. And so, at this stage, you'll be permitted to pose that question to the Leader of Government Business. If he's aware of or know when the questions will be answered, and then I take it from you.
Mr. Speaker, I normally refer to you as the Speaker, and I'm asking through you to the Leader of Government Business whether the Prime Minister is coming today to answer the questions which I heard in the public domain that he intended to do. I'm addressing you. You have always told us that we must address you, so I'm doing so. I don't want to speak across directly to the member.
The Leader of Government Business has spoken on the matter. Mr. Semudo, do you have any further update to advise us the questions that are asked that are due to be answered today, whether or not those who the questions are asked of will be in a position to do so?
You know, this is so unnecessary. Mike is on. This is so absolutely unnecessary. The member knows fully well that in matters of this nature, I am referred to directly and I respond. It has been so for the last year almost since I've been here. What is this new departure in aid of? Because it is of no benefit to the member, because the answer remains the same. And let me be very precise. The Honorable Prime Minister of Jamaica will not be answering any questions today. End of story. So you may wish to go to the Speaker or anybody else. The facts are as I have stated them.
So the statements, you know, Mr. Speaker, I only refer to you because you are the Speaker. I don't know why the leader of government business is taking this approach. The Prime Minister on Sunday at a public meeting indicated publicly that he was coming to the House today to answer the questions. That's the basis on which I've asked. So don't come here and behave that way.
So you are in a public forum and come to Parliament today? Mr. Robinson, Mr. Robinson, the day has... Order, please. The day has just started. The Prime Minister is not here as yet. If the Prime Minister enters and wishes to answer the questions, we will suspend the standing order to permit him to do so. Until he arrives here, we can't tell you whether he's going to answer them in a position to do so or when. When he comes, we will question that. Motions that may be made at the commencement of public business. Motions relating to the sittings of the House. Motions for leave to introduce bills. Presentation of bills without leave of the House first obtained. Public business. Minister Samuda.
Mr. Speaker, I seek your leave and that of the members of this House for me to have withdrawn the resolution regarding the pension superannuation funds and retirement schemes investment amendment regulations to 2019. Standing in the name of the Minister of Finance, who has just entered the chamber, Mr. Speaker. If it's the wish of the House.
Yeah. All right, Carl, should I just get up and withdraw it?
Is it the wish of the House to proceed as he has requested? The resolution is now.
You can just get.
Recommit orally.
Members, when I ask a question,
I'm hearing that the opposition has other comments.
I proceed based on the answer I get. Is this the wish of the House as requested by the leader of government business? The resolution is now withdrawn.
I'm going to, at public business. No, the notice the motion given orally.
Announcement.
You have it there, yeah?
Yeah, to recommit it, yeah.
Mr. Speaker. Mr. Speaker. Mr. Speaker. Mr. Speaker. Mr. Speaker, I ask for a recommittal of... The Minister of Finance has a matter that he wishes to bring to the attention of the House.
Mr. Speaker, I win the recommittal of notices of motions given orally.
Members, the leader having withdrawn and got the announcement, got the withdrawal approved. The next item is announcements. Announcements. Dr. Clark.
Mr. Speaker, I ask for a recommittal of statements by ministers.
Those in favor? Those against? The ayes have it.
Just before, Minister of Health, just before you say, Mr. Speaker. Mr. Speaker.
Statement by Minister. Dr. Clark, are you the person to proceed? Oh,
Mr. Speaker.
Minister Tufton.
Mr. Speaker. Just before Minister Tufton, on a point of information. Mr. Speaker, given that the Prime Minister tweeted out earlier today from his Twitter account that he would be tabling a bill to deal with the expropriation of the 49% of the PDVSA shares in Petrojam. I'm just inquiring whether the Prime Minister will be making a statement on that issue.
Will you wait for an appropriate item to ask that question?
Mr. Speaker, we recommitted statements by ministers.
A statement by minister and Dr. Tufton has been asked to proceed.
Statements by minister, if we will have a statement from the Prime Minister on the bill that he tweeted out earlier today that he will be tabling in Parliament. It's a matter of national importance.
Mr. Bunting, a question about the statement is not the statement. I recognize Dr. Tufton to proceed with a statement he has requested at this time. Dr. Tufton.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. Mr. Speaker, I wish to update this Honourable House and the people of Jamaica on the current position of the dengue outbreak. As at February 8th, the Ministry of Health has classified some 1,166 suspected, presumed, or confirmed dengue cases with dates of onset in 2019, so since the start of this calendar year. 2018, Mr. Speaker, you may recall, had, yes, copies are being circulated. Copies 2018, Mr. Speaker, you may recall, had some 1,023 suspected or confirmed cases. The weekly number of cases appear to be plateauing, Mr. Speaker, while we need to wait for another 2 or 3 weeks to be sure. The experts, in the opinion of the experts, the clinical experts who are monitoring the situation, this is an encouraging sign, and they monitor week by week, and the information or the indication suggests that come February you'll see a balancing off and then a downward trend in terms of the number of cases. We can't be complacent, however. The largest number of suspected, presumed, confirmed cases, Mr. Speaker, for 2019 were notified from St. Catherine with 313, followed by Kingston and St. Andrew with 177, St. Anne 121, St. Mary 75, St. Thomas, St. James 54, and Clarendon 49. Mr. Speaker, as at February 2019, February 8th, 2019, there have been 6 confirmed deaths, 5 from Kingston and St. Andrew and 1 from Portland. These confirmed deaths have been children under the age of 14 years. Mr. Speaker, the most effective way to contain this outbreak continues, in our opinion, in the opinion of the experts, through community engagement. And I have had the opportunity over the last few weeks to visit all 14 parishes to review the work being done. I am pleased to report that the enhanced vector control program was continued, and approximately 1,000 vector workers, temporary workers that is, were engaged for a period of an additional 3 months. Fogging and larvicidal activities were increased across the island with all high-risk areas, that is, areas with clusters of cases, and also, Mr. Speaker, in key institutions such as schools. Mr. Speaker, I can report that during the month of January, the following vector control activities were carried out. 1,222 visits in communities for house-to-house inspection, with repeat visits done, representing some 69% increase over the previous 5 months. 390 fogging sessions completed with 1,260 areas fogged, our communities, 249,924 containers inspected, 31,688 containers treated, 320 key premises inspected, Mr. Speaker, key premises being tire shops, garages, dump sites, 1,226 key institutions inspected. These are schools, hospital, infirmaries, lockups. 724 key areas inspected, and these include high-risk communities, markets, urban centers, ports of entry. Mr. Speaker, a part of our community engagement has been the involvement of members of this Honourable House with the 13 municipal corporations, of which Cabinet has approved some 55.7 million to members of Parliament and 100 million to the corporations, that is the municipal corporations, to undertake, among other things, vector control activities. I must say that there have been some issues with the parish council allocations. The MPs should now be able to access their allocations via the parish councils, and they can use those allocations. It's there now. I checked up to today, unless some of the councils are slow in terms of dealing with it. But I know that the Minister of Local Government has dispatched those funds with a list of what is to be allocated to each member of Parliament. But there are a few glitches as it relates to the parish council allocation, but we're working to sort that out during the course of this week. Mr. Speaker, a total of some $600 million has been allocated to the dengue outbreak response so far. In terms of intersectoral collaboration, the Ministry of Health has partnered with several agencies and entities in its response to the dengue outbreak, including the National Solid Waste Management Authority, which has been given a list of critical communities from which bulky waste was to be removed. The National Works Agency, Mr. Speaker, where particular drains susceptible to the breeding of the Aedes aegypti mosquito were targeted for cleaning. USAID, Mr. Speaker, which continued to support the ministry during the outbreak through the ZAP program, where some 158 ZAP workers were engaged in January to assist the ministry and have carried out activities in some 94 communities. The Jamaica Red Cross, which has mobilized its volunteers across the island, with some 2,000 volunteers to be mobilized to distribute educational flyers in several communities. Mr. Speaker, we have also had tremendous support from the Chase Fund, the TEF, UNICEF, PAHO, and the NGO, local NGO, Food for the Poor. Of note, I wish to mention members of the private sector, Mr. Speaker, that have also provided support in responding to the dengue outbreak. I must make mention of our telecommunication service providers, that's Digicel and Flow. Both have helped to enhance our public education campaign through their text messaging service, which they gave free of cost. And through that service, some 1.3 million persons were reached with messages around prevention and protection. Mr. Speaker, work continues in clinical management with the sustained sensitization of all private and public doctors. Parish medical officers of health were resensitized on response and enhanced surveillance. The integrated management strategy to include enhanced vector control activities and also clinical management. A series of training workshops for clinicians across the 4 health regions were held, and electronic copies of current clinical guidelines on dengue prevention and control were disseminated. Additionally, Mr. Speaker, copies of dengue protocols were sent to all hospitals and the medical nursing associations. Our extended opening hours continues to facilitate increased access by patients needing medical care at selected health centers. Mr. Speaker, in relation to the availability of medication through the Ministry's Health Emergency Operations Center, the stock levels of certain drugs continues to be monitored, including paracetamol tablets, paracetamol syrup, oral rehydration products, and intravenous fluids. Mr. Speaker, again, I wish to reassure the public that the team at the Ministry of Health is doing all that it can, including its stakeholders, to ensure the best possible health outcomes for those currently affected by dengue and to prevent the spread of the virus to other members of the population. For the month of February, Mr. Speaker, working with our regional and international collaborators and local partners, regional and international being CARFA and PAHO, WHO, we will sustain our response efforts to ramp up the vector control management, public education, and clinical management, Mr. Speaker, until we are comfortable that the numbers are in fact going down towards normality. We will take nothing for granted. We urge, Mr. Speaker, Jamaicans to search, to destroy mosquito breeding sites around their homes, visit their doctors if they experience symptoms, and follow the prescribed course of treatment. Mr. Speaker, while we redouble our efforts to contain this dengue outbreak, I wish to advise this Honourable House and the people of Jamaica that there is a significant increase in the number of cases of fever and respiratory influenza-like illnesses, and I'd like to use this opportunity to place the country on alert as it relates to the influenza virus, Mr. Speaker. In other words, we're working on dengue, and I see signs of hope in terms of restoration to normality. But we are also now seeing indications of an increase in a particular type of influenza, which is affecting individuals and, by extension, the capacity of the public health system to respond. Seasonal influenza, Mr. Speaker, or the flu, is an acute viral infection that spreads easily from person to person, mainly by coughing, sneezing, and close contact. The viruses circulate worldwide and can affect anybody in any age group with symptoms varying by age and include fever, chills, sore throat, muscle aches, fatigue, cough, headache, and runny or stuffy nose. From data captured by the Syndromat surveillance system from the 78 centennial sites throughout the country. The ministry has seen an increasing trend in this syndrome, Mr. Speaker, over the past week and a half, 2 weeks. Therefore, Mr. Speaker, we are indicating an early warning to the country, to the public, to be on the alert for this possible influenza increase. Trends are done for 3 age groups, Mr. Speaker: children under 5 years old, those 5 to 59 years old, and persons 60 years and older. Parishes with increasing trends since 2019 includes Kingston and St. Andrew, Trelawney, Clarendon, Manchester, St. Elizabeth, and Portland. Mr. Speaker, we wish to advise this Honourable House and the members of the public that the flu is to be taken very seriously, as it can lead to pneumonia and blood infections, cause diarrhea and seizures in children. The flu can also worsen chronic medical conditions, Mr. Speaker, such as heart or lung disease. So if you have an underlying condition, then having this bout of the flu can actually make things worse. Persons at greater risk, Mr. Speaker, of dangerous complications from the flu are infants and young children, adults 65 years and older, pregnant women, and persons with chronic medical conditions or a weakened immune system. Mr. Speaker, in preparation for this flu season, a total of some 21,900 doses of influenza vaccines were purchased by the Ministry of Health through the Pan American Health Organization Revolving Fund for vaccines and distributed to parish health departments back in late October last year, 2018. And vaccination of target groups commenced in November 2018. Persons from the high priority groups include healthcare workers, children and the elderly with chronic illnesses, especially those on the PATH program, pregnant women, particularly those on the PATH program, individuals who are institutionalized or in the state care, and non-health frontline workers. We can access a vaccine, Mr. Speaker, from any public health center, clinic, free of cost. The healthcare providers in the private sector are encouraged to procure the influenza vaccine through private distributors to provide for the general population, with emphasis on the high-risk groups that I mentioned earlier. The vaccine can be had privately by members of the public from any general practitioner and pediatrician at a minimal cost. So we encourage Jamaicans, Mr. Speaker, those who can afford to, see your private physician, take necessary precaution, but we also have a supply within the public health system which can be accessed primarily by those who are in the vulnerable categories. In terms of the activation of the alert status, Mr. Speaker, by activating our protocols for an alert status for fever and respiratory influenza-like illness, the Ministry of Health will immediately initiate the following actions. Firstly, enhance its public education campaign to reinforce good hand hygiene and emphasize respiratory etiquette. Activate enhanced infection control program in hospitals and health facilities for prevention, controlling and investigating communicable diseases, increasing stocks of medication in hospitals and health facilities to respond to increase in the number of persons hospitalized. And Mr. Speaker, I want to just say that part of the manifestations of this increasing cases of influenza is the crowding effect in the accident and emergency rooms. And we are seeing many cases of that where persons are waiting with respiratory illnesses to be admitted, but the capacity of these institutions is just not there to deal with the numbers. And so the public will experience some inconvenience over time until we bring the situation under control. We will continue and expand the extended opening hours at health centers to provide access to high-risk populations, to include the elderly and children under 5 years. And this is important, Mr. Speaker, because what we're saying is visit your health centers. We have extended opening hours, and therefore start there before you go to the accident and emergency rooms, because those facilities are under pressure at this point in time. continued implementation of the overcrowding management plans for the major hospitals across the island. Mr. Speaker, the implications of this increase in the number of cases of the flu will mean that members of the public will experience longer waiting times at public health facilities, and so we use this opportunity to crave their indulgence as we seek to ensure that all those who visit our facilities will receive appropriate treatment. We strongly encourage members of the public, Mr. Speaker, as part of the prevention mode, to practice good hygiene, as this is essential to minimizing, reducing, or eliminating the risk of persons contracting the influenza. Mr. Speaker, thank you.
Mr. Speaker. Thank you very much, Mr. Speaker. May I be allowed to speak from a seat other than my own?
You may. Go ahead.
Minister, I want to thank you for the update on the dengue outbreak that we have been having, as we all recognize that it is a national crisis, one that every sector of the economy has to be involved in. I just have a few concerns and questions that I'd like to ask. You indicated in your statement that there have been 6 confirmed deaths, 5 from Kingston and St. Andrew and 1 from Portland. However, we have seen in the media cases coming from other places in the country, and there is an indication that the 6 that has been reported here is not the entire number. The question that I ask, even as I look at page 3 or page 5 on your statement about the clinical management and sustained sensitization and the input of all the private and public sector partners, what improvements have been made in the diagnosis of dengue? I can understand that the minister's statement will be on those confirmed coming out of the Caribbean Public Health Lab, but there was an indication that local facilities would be given this, and the 6 that we are seeing here, is that the sum total of those who have died as a result of dengue complications, or is it just that this is the 6 that have number that has come back from the Caribbean Health Laboratory?
Thank you for that question. The total number of suspected deaths linked to dengue is 29 since last year. But the numbers I gave were the confirmed ones, meaning the follow-up tests that were done to confirm. As you know, some tests are done here in Jamaica, others are done in Trinidad at Carrefour, and the confirmation test is done in Trinidad. So I did not want to say 29 over the past year and 1 month until we got full confirmation. So we continue to await the results of those tests, because we have had cases of tests being done that came back negative. So I didn't want to comment on the suspected.
At your last statement in the House, you indicated, based on questions that were asked, that the laboratory at the University of West Indies would have been beefed up to deal with that particular deficit that we have been having coming out of Trinidad. Can you give the House an update on what has transpired there, and whether that laboratory is now capable of giving confirmatory testing for dengue?
I don't have the sort of technical terminology, member, as not being a clinician myself, but I'm told that remember, I just have a doctorate, but I'm not a doctor, as was said by your colleague on the opposite side a few weeks back. But we do have some equipment, and we have limited HR capacity. So that's a part of the burden. There needs to be some additional HR capacity, which would allow us to do more complicated tests. Beyond that, however, and we're working towards it, beyond that, however, CARFA is the accredited lab that is recognized in the region for reporting purposes to our international partners for the disease profile of the region. And there is no such accredited facility in Jamaica. In fact, CARFA is partly owned by Jamaica. CARFA is the CARICOM equivalent of a health agency. So we all subscribe to and support CARFA's operation. So while it is geographically remote, technically speaking, it is our agency that actually does the final confirmation.
I'm mindful of that, Minister. The only challenge I have with that is the geographic location and the speed at which these samples can get to Trinidad and the results come back to us. So is there any thinking between the Pan American Health Organization, CARPA, and the University Hospital of the West Indies to give them accreditation status so that they could also report on this? I say that against the background that, as you have indicated here too, that without the confirmatory tests, sometimes the misdiagnosis is made and hence mismanagement, and as was indicated in previous statements here too, wrong medication, which I'll not call the name of the proprietary medication, was prescribed for fever and pains. So it is something that it is not only important for dengue, but for all the other viral and bacterial illnesses that we have, which is one reason why I'm asking and pursuing this particular line of questioning.
Quickly remember, the fact is that we can do tests to determine whether someone is contaminated, affected, afflicted with dengue, the dengue virus. Of course, you would know clinically that there is a window that allows that test to return a credible response. So it depends on how long the person experiences symptoms before they went to the doctor, before the doctor administered the test. So we do have the capacity to do some of those tests. The ultimate confirmatory test, however, once a person unfortunately is deceased and there is suspicion of dengue, is a test that is done by the accredited institution. And frankly speaking, while we are pursuing more upgrades, it would, in a sense, be a duplication of effort, given that we also own CARFA. It's just that the testing site for these kinds of tests are done in Trinidad. But we can do tests here to administer the clinical application to deal with the problem once the problem is suspected.
Minister, you indicated in the statement that there is monitoring of the medication, the necessary medication for treatment of dengue across the island. I am a little concerned by the use of the word monitoring, because that does not necessarily translate into availability. And indeed, there have been reports in some health centers across the country that there is even basic medication such as paracetamol which is not available. Can you give us a better update as to the stocks that are available and what efforts are being made to ensure that reporting is done to the centralized unit so that if there's a perceived shortage coming up, that the ministry can respond in a timely manner?
Let me just say that there is no shortage of medication in the public or private health system. We have said paracetamol, which comes in several forms, is available. It's available through the private distributors. It's available in the public health system. So we don't have a difficulty. We have embarked on public education programs to deal with the clinical application of medication to avoid errors by the clinicians, to avoid, of course, the amplifying the problem. And you would have probably seen some of those ads, public education programs. We also did a Dear Doctor letter, which was sent out to all physicians to guide them in terms of the symptoms or remind them, because they should know. And we feel that there have been some errors, frankly speaking, in the early stages. but we think we have passed that hurdle now, given the heightened awareness of the problem.
Minister, I think you misunderstood my question. I was not alluding to a shortage of paracetamol in the island. I was saying that there are some public health centers which do not have that readily. And patients, and we recognize that even though the cost is not that significant for a bottle, some patients really can't afford it. So I'm just asking if there are adequate measures in place in the ministry to ensure that in the centers where they may be coming to a low number of bottles, that the ministry can immediately respond to have that correct.
And the answer to your question is yes. We are in a position to respond.
Minister, as it relates to your second statement on influenza, yes, it's something that is expected as you have indicated. Question is, has there been any reported influenza complication deaths so far reported to the ministry?
I don't have the specific details. Suffice to say that the experts in the ministry, epidemiologists, and the various satellite locations across the country, the A&E departments in a number of the hospitals, observation, analysis, and data collection suggest that we are bordering on an outbreak of this particular type of influenza. And what it means, we're seeing it manifesting itself in the A&E, where a number of persons are turning up with upper respiratory issues, persons who have to be admitted, which is amplifying the problem of shortage of beds. And so there are probably 8 or 9 hospitals now, looking at the data up to yesterday, where you have 10, 15, 20, 30 persons waiting to be admitted with these symptoms. So given the data, given our international obligations in terms of tracking trends and looking at the average numbers, we felt it was necessary to just raise the alarm to say we are moving in a particular direction which is of concern, and as a consequence we have to trigger some additional measures to create awareness and treatment.
Mr. Speaker, given the that you have given in respect to the number of confirmed cases, especially in St. Catherine, can you say what would be the number in the municipality of Portmore?
No, but Portmore would represent one of those areas where we have a heightened awareness because of the numbers there. I can't remember offhand, but the numbers I gave you, 331, represents all of St. Catherine. Portmore is probably one of about 5 locations, geographic locations. Others being Spanish Town, Linstead, and 2 or 3 others that are considered to be major areas given the number of cases or suspected cases that we have had. As a consequence, our strategy have actually channeled attention in those areas in terms of fogging, house inspections, and collaboration with our agencies like solid waste.
Mr. Minister, with the different stakeholders, and I recognize the need for additional beds based on the urgency of the matter. Is there any consideration to work with private hospitals so that you can make reference in the case of emergency?
We work with stakeholders, including private entities, for a number of services in terms of the actual bed shortage. We do work with, if not fully private, semi-private, St. Joseph's, UWI, and we try to filter. But the reality is that the options The options are not that great. You don't have a lot of private hospitals in Jamaica. But we do depend on our stakeholder groups from time to time as the need arises. It is unlikely that we would be able to satisfy the demand right now on beds, even if we were to engage all of those that exist, because the demand is quite high, unfortunately.
Mr.
Dr. Ferguson.
Thank you. Mr. Speaker, Minister, the report that I have before me, I note that you spoke earlier about the sums that were allocated to the local authorities. But in looking at the report that is in front of me, I'm not sure if I'm missing it, but I am not seeing, when you speak of the intersectoral collaboration, any mention made of the local authorities. And this is an issue that I've been speaking about, and the councils themselves have been speaking about it. One thing is to make an allocation to the council. The other is to recognize them as an important stakeholder in the matter, and therefore to acknowledge them as such. I believe the absence of that from this document could send a wrong impression. I don't know if you could clarify for me.
Well, there's no intention to suggest that the local authorities are not an important stakeholder partner. And as said in the statement, a certain sum will be allocated or has been allocated to them. And the health authorities do report to the councils once a month, and they have been mandated to report and where possible share resources. Indeed, some of the parish councils have actually provided logistic support, the municipal cooperation. So we're working together, and if that impression is given, let me just say that that's not the impression that is correct.
Minister, am I to understand that you're saying for the year 2018, 1,023 cases, and since January to the 8th of February 2019, there are 1,166 cases, suspected cases in 5 weeks. I would like to know, Minister, have you been doing, how many of that number has been tested, whether in Trinidad at Carrefour or at the University of the West Indies?
How long does the results from Carrefour takes to get back to the Ministry of Health in Jamaica?
So in response to the first question, yes, it does show that January certainly represented the peak of the storm. Based on what the clinicians are saying, they think February you'll see a tapering off and then a decline, if not in February, certainly in March. Well, they are seeing encouraging signs that it is tapering off. In some parishes more than others, and then eventually you will see a decline. So that's how the cycle works normally. And I think we're lucky, frankly speaking, or we're seeing the benefits of efforts, public awareness, citizens' action, where the outbreak may last a few months as opposed to a much longer period. Do recall, remember that the outbreak started in December. We discovered it on the 3rd, and then it went very rapid in January. I suspect too also that there have been better reporting and more fulsome reporting by physicians. You know that the physicians are required once they suspect to report, but frankly speaking, many don't. So I think with the heightened awareness, you are seeing some of that taking place, which is why those numbers are the way they are. But yes, it does take some time. Now, in terms of testing, I don't have the actual numbers. I can get them, but I don't have them. But yes, you can do some tests here to determine. And in terms of Carrefour, my understanding it takes 2 weeks, I think it is, to the other member's question, about 2 weeks or so. But it doesn't necessarily always work out that way. It's supposed to, but more often than not, it takes longer than that.
In relation to the testing, isn't it a fact that the only way you can confirm dengue is by testing? I mean, persons have had their clinical assessment, which oftentimes is positive based on experience. But officially, using WHO PAO standard, it would be by confirmation lab. And that is why I was trying to get the number of cases tested. But you say you'll get that for us. Secondly, you spoke to between 2018 and 19, suspected 29 deaths from dengue, but only 6 cases confirmed of deaths. How many of those deaths would have been in 2019?
You mean if you're asking about the suspected deaths? Well, let me answer the first question. As I understand it, and again, you are slightly in a better technical position than I am, based on your core discipline. But the clinical protocol for dengue also includes initially a judgment on the part of the physician based on certain displayed symptoms, fever being the key one, as I understand it. I think it's fever and 2 others. And the protocol is for the doctors to administer once those symptoms are discerned. But you're right, as it relates to confirmations, it's a function of the blood test, the particular test. And there are a number of testing methods, including this quick turnaround test, which the clinicians tell me is reliable up to a certain point. So the reliability of it is not a full 100%. And sometimes there is a reluctance to depend solely on that. In other words, they have tested patients that come back negative, but then further and more detailed tests suggest the person was positive. And so the real and ultimate test is the one that's done at CARFA in Trinidad, just to answer that question. And you said the second part of the question was what again? Oh, you mean how many deaths? Sorry, you asked me how many suspected deaths. It's 29 in total, I'm told. I believe last year it was 11 or 12. I may need to check that, but I think it was about 11 or 12 deaths that were suspected. The rest would have been during the course of this year.
Minister, that there were no confirmed deaths last year. How many confirmed that we had last year? And how many this year?
Can I get back to you on that, just to be clear? I don't want to announce and then we're not, yeah?
All right. You can get back to me with that. Just one. In relation to, you said the 6 deaths had to do with children under 14. Across the country, in these impacted parishes, there are deaths that are taking place that is attributed to dengue, especially persons with chronic disease or compromised health. You are saying to us today that the number of confirmed would be 6 and all under 14. I know of one case at St. Anne's Bay Hospital, 25-year-old patient, bleeding all over, which dengue hemorrhagic has been the diagnosis. What I would like to know, Minister, are they, your technical persons, and the data you're getting have confirmed any adult deaths?
Let me just say, remember, this is the report that I have. I am well prepared to go and check based on your questions. And if there are any errors in that report, then I'll happily correct it publicly. But based on what I have here, the 6 confirmed fall within that age category. But the 29 that are suspected would go beyond that age category. So it is a matter now of trying to get the results of the others, and it may include the one that you referred to, you referenced.
We go back to excited about the presentation of bills without leave of the House first obtained. Dr. Chuck.
Mr. Speaker.
Mr. Chuck.
Mr. Speaker, I now move to introduce and have read the first time a bill short entitled the Law Reform Amendment of Penalties Act 2019.
A bill shortly entitled the Law Reform Amendment of Penalties Act 2019, read the first time.
Mr. Speaker, I beg to give notice of second reading of the bill.
Public business.
Mr. Speaker, the Minister without portfolio in the Economic Growth and Job Creation Ministry will complete the matter that has been standing for some time now, the Trust Act 2018. He will close the debate today.
Mr. Darrell Vaz, please.
Thank you, Mr. Speaker. Mr. Speaker, as members of this Honourable House will recall, the Trust Bill was tabled in May 2018, and the debate was suspended to allow the opposition to provide their comments. Mr. Speaker, the opposition provided their comments in writing, and consequently the list of proposed amendments tabled before you today was prepared. The amendments include Clause 2 was amended to include the definitions for the word bankrupt, to have the meaning assigned to it in the Insolvency Act, and protective trust, which is to be construed in accordance with Section 53 of the Act, which provides for protective trusts. Mr. Speaker, the definition of trustee was also deleted and substituted to read, means a person to whom Section 4.1 applies and includes a corporate trustee and the Administrator General when acting as trustee pursuant to the Administrator General Act. In revising the definition of trustee, the words receiver or government trustee when acting as trustee pursuant to the Insolvency Act was deleted as a person appointed in this capacity, deals specifically with the assets and liabilities of the person facing insolvency.
Mr. Speaker, if I may, on a point of order, the Minister, I believe, is closing the debate right now. Yeah, I had hoped to have an opportunity to say a few words on the bill before you closed. I hadn't realized that we were at the stage where we're closing. Yes, so I don't know if you mind. I literally 2-3 minutes. If you have no objection. Thank you. Thank you, Minister.
You may go ahead, Mr. Gold.
Thank you, Mr. Speaker. Mr. Speaker, the legislation that is being debated now is dealing with trusts, which are a vehicle for the owning of assets. Typically under settlements whereby property is vested in trustees to hold on behalf of either named beneficiaries or a class of persons from which beneficiaries may be appointed by the trustees pursuant to a power of appointment. It is part of a compendium of legislation that is supposed to be establishing Jamaica as an international financial center, which is in keeping, I believe, with the thrust that Jamaica has been pursuing to generate higher levels of growth and national development. When we were in office as the government prior to February 2016, we had tabled the two partnership acts, the General Partnership and the Limited Partnership Acts, and the Trust and Corporate Services Act, all three of which were passed after the change of government. Since then, we've had an International Business Companies Act tabled, which is really, I think, the most important of all, and the Trusts Act as well. The International Business Companies Act has not gone any further since being tabled. I had shared with the Minister my comments on the bill, which were fairly extensive, and I am hoping that we will see it brought back very soon, because I think in light of what is happening internationally, in other jurisdictions which have traditionally attracted that type of business, with the stance taken by the OECD countries and so on in relation to higher levels of disclosure and that sort of thing, there is going to be some demand for repatriating companies that may have been formed abroad and that are holding assets, but also for the formation of new companies in Jamaica under a tax regime which is not yet finalized as far as I know, but which I understand to be trending around the same kind of income tax corporate rate, headline rate, as applies to the special economic zones. And if that's still the policy, then that should be reasonably attractive, though not as attractive as, say, Barbados is, where the new government has brought in an income tax rate for all companies, including domestic companies, between 1% and 5% on a sliding scale, with 5% being the highest rate, depending on the level of income. So I think that there's an opportunity for Jamaica. It's not clear how valuable that opportunity will be, because until one is fully established and promoting it with all the legislation in place that needs to be to support it, you won't really know. But enough work has been done over the last decade, almost, on this international financial center that we really need to get the key elements to it, the key components in place. And the companies bill is, I think, the most important of those, Minister. And I would hope that we can see it brought back here in an amended form and pass it quickly when we do bring it back here. There are also the regulations under the partnership legislation, which, although the partnership legislation has been passed nearly a year, those regulations are not yet in place. So that you can't use the partnership legislation even today. And an important element of that, I believe, is a possible amendment to the regulations of the legal profession, which, as I understand it, do not permit the transitioning of a law firm partnership to a partnership under legislation without those regulations making a simple amendment that would allow that. And that's an important piece in the puzzle. Very simple, but important for the partnership thing to really take off. And I know there are many firms that are anxious to take advantage of the partnership legislation and some of the flexibilities and protections that it offers them. So, Minister, I would just say if we could see some progress on the regulations under the Partnership Acts, and if we can see some progress on the companies legislation itself coming back here with those amendments, that would be a good thing. And I support the trust legislation with the amendments that you've already started to outline and very kindly given me the opportunity to say these few words. I haven't studied them in depth to see to what extent the ideas that I had shared with you have been incorporated, but to the extent that there are any that are left out, perhaps in the Senate there's another chance to look at that. But we support a modernized framework for trust. Thank you, Minister.
Thank you very much,
Mr.
Member.
Vaz.
And just to say once again that we know the integral role that you played over the last few years when you were on this side of the House. And I would say to you that we are having some protracted discussions with the Ministry of Finance. The Minister of Finance is very aware of it and in touch with our chairman. And I'd encourage you to have a discussion with him as well. So, Mr. Speaker, I will continue in terms of the bill where I left off. In revising the definition of trustee, the words receiver as government trustee when acting as trustee pursuant to the Insolvency Act were deleted as a person appointed in this capacity deals specifically with the assets and liabilities of persons facing insolvency rather than being a key component in a trust. Clause 3 was amended to specify that this act applies to foreign trusts over which a court has jurisdiction under Clause 6 to 1B, which sets out the circumstances under which a court will have jurisdiction in respect of a foreign trust. Clause 63(1)(b) was deleted. This deletion resulted from the amendment to the definition of trustee in Clause 2 to include the government trustee appointed under the Insolvency Act. Clause 41 was amended to expressly provide that the trustee is subject to the duties established under this bill when appropriating trust property to satisfy the interest of a beneficiary of the trustee in circumstances where the trustee does not have the consent of the beneficiaries. So, Speaker, this was achieved by amending the provision to read, subject to the terms of the trustee and the duties of the trustee under this Act, the trustee may, without the consent of the beneficiaries, appropriate trust property in or toward the satisfaction of the interests of a beneficiary in such manner and in accordance with such valuation as he thinks fit. Clause 44 was deleted and a new provision inserted. In the bill as tabled in May 2018, this clause provided that a trustee is entitled to charge and be paid for services rendered. Also, the trustee was entitled to be reimbursed for proper expenses incurred when carrying out the trust. The trustee or former trustee claiming to be entitled to any fee or expense could apply to the court for an order stating that a first and paramount charge is over the trust property in the amount equal to all outstanding fees and expenses in favor of the trustee or former trustee. In amending the clause, the provision for the creation of a charge over the trust property was removed. The amendment provides that a trustee is not entitled to remuneration for his services unless authorized by terms of the trust, consent in writing of every beneficiary, of an order of the court, and the trustee is authorized to pay from the trust property and reimburse himself for the trust property, for all expenses and liabilities properly incurred. Clause 48 was amended by deleting subclause 1 and replacing it with a new subclause. This amendment makes it clearer that the trustee's liability is a fiduciary to the beneficiaries of the trust in relation to the conduct of the transaction or matter is not being excluded. Clause 68 was amended in two places. In subclause 1b, the word person is being substituted and replaced with the word child so as to read an unborn child. Mr. Speaker, an amendment was also made to subclause 3, whereby the word the appearing before the word person is deleted and replaced with the word that. In clause 76, in subclause 2a, the word he is being substituted with the words the beneficiary in order to make it clearer who is being referred to in that clause. Clause 78 was amended by deleting and replacing the subclause 1 using clause 78.2 as a guide. Mr. Speaker, this amendment made the provision easier to read. And finally, Mr. Speaker, clause 92, which provides the time frame in which this act must be reviewed, was increased from 5 years to every 7 years, given the very complex nature of this area of law. Mr. Speaker, I now close the debate on the trust bill and the list of amendments be treated within the committee.
You're asking that the bill be read a second time?
Yes, yes, I now move for the bill to be read a second time.
The question is that the bill be read a second time. Those in favor? Aye. Those against? As have it.
A bill entitled An Act to Make Provision for the Establishment and Administration of Trusts and for Connected Matters, read a second time.
Members, this bill will not proceed any further. We will not proceed with this bill any further until the next week. That's the advice from the clerk. Next item, Mr.
That being the case, Mr. Speaker, I invite you to ask the Minister of Industry, Agriculture and Fisheries to take the matter standing in his name dealing with Food Storage and Prevention of Infestation Amendment Act 2018. I might just give notice of the intention to hear from the opposition spokesman. Sorry, the opposition spokesman, I'm sorry. The opposition spokesman will respond to the bill that was presented by the minister previously. But we are not going to, the minister is going to seek suspension of the matter and not take it through all its stages today. However, you can invite the minister now to deal with an act to amend the Protection of Plant Genetic Resources for Food and Agriculture Act 2018.
Mr. Chuck. Dr. Ferguson, you would.
My response would be to the Food Storage and Prevention of Infestation Act that the minister spoke about on the 8th of January. Mr. Speaker, the Food Storage and Prevention of Infestation Act and regulation was passed in 1958, with regulations being passed in 1973, 25 years later. Based on the minister's presentation, my own research, It is very clear that it is an outdated act as is now, Mr. Speaker. The opposition has no fundamental problem with the amendment to this act. We believe that what it presents for us as a country, safer food, better quality food, and it will also enhance the way our food is stored, how it is transported, and how it is delivered. And therefore, Mr. Speaker, the Act itself presents, the present Act presents significant challenges. And therefore, what we want, and I am saying, Mr. Speaker, that the division that deals with storage and infestation, their work have been significantly impeded as a result of not being able to have access to documentation as it is in the present bill. They are not able to deal with the provisions as it relates to the transportation of food that could be in contaminated space or infected areas. And we see this amendment to the bill as an important step going forward. It responds also to the new technology that we are working with and the period in which we now operate. The opposition believes, Mr. Speaker, that with these amendments, in fact, 10 amendments, clauses 1 through 10 of the Principal Act, a number of amendments to the regulation, and also new regulations, we believe, Mr. Speaker, that it is a step in the right direction. It is a step that will put food safety significantly on the agenda. And I do believe that as we go forward, Mr. Speaker, we will act swiftly in getting these amendments in place, because our country would be better for it. Safer food, better quality, the way we transport and store. With all that, it is the opposition's view that it's an amendment that is worthy of commendation.
So, Mr. Speaker, we ask that both matters be suspended, as it is intention to carry it forward into the next session of Parliament.
Those in favor? Those against? Ayes have it. Public business continue. Public business.
Mr. Speaker, Mr. Speaker, I ask for a recommittal of notices of motion to enable.
Those in favor? Aye. Those against? Ayes have it. Go ahead, Mr. Chairman. Prime Minister.
Thank you, Mr. Speaker. Mr. Speaker, I beg to give notice that at the next meeting of the House, I will move to introduce and have read a first time a bill shortly entitled the Compulsory Acquisition Shares in Petrojam Limited Act 2019.
Mr. Speaker, you will recall, Mr. Speaker, that the untimely passing of the member from Eastern Portland left us quite saddened. He had on the table of the House a resolution, a motion, and that motion, number 72, standing in his name, dealt with a matter that I am sure will be of great interest to this honorable House. The member from Western Portland, in his tribute, supported, and we have all supported, the suggestion that we take the motion in memory of a fine man who served in this House in an honorable fashion. Unfortunately, he is not here to take it himself, and I understand that the Leader of the Opposition will either take it himself or name someone. It is our intention to have it taken now. Yes.
Those in favor? Those against? The ayes have it. Dr. Phillips?
Mr. Speaker, honorable members, I have the distinct honor, though I must say it is a sad duty, to pilot this motion standing in the name of the member who formerly represented Portland Eastern, who was brutally slain 2 weeks ago. It's best to begin by stating the motion that is before us. The motion, private members' motion number 72, resolves that the Honorable House recommend that Port Antonio Square be renamed Nanny Square, and that a statue be erected in that square in her honor, and that any necessary attendant infrastructural and other modifications to the said square be undertaken and completed to recommend our high regard and respect for her status, and that the passage between breastworks in Port Antonio and Nanny Falls be named the Nanny Trail, with all attendant issues arising from this change completed in a matter befitting her status as our sole national heroine. Mr. Speaker, Nanny is one of those transcendental historical figures that has existed in our past. History records that she lived in the early 1700s and was one of the foremost military commanders of the enslaved African people who had managed to win their freedom by leaving the plantations. She led her troops against the occupying British forces and fought them to a stalemate. Indeed, defeated them to the point where they sought a peace treaty with the Maroons, and is perhaps worthy of particular note because she was among the strongest of Jamaican women. She was born in Africa herself, and she, by virtue of her military prowess, was able to free, by releasing from the plantations more than 1,000 of the enslaved Africans among what was called the Windward Maroons on the eastern side of the island. And she was feared by the British troops, who called her the old African Obia woman. They felt that she had powers, not only the usual military powers which were recognized by the British, but one might say supernatural powers which caused them to cower in fear when her own troops approached them. Throughout our history, Mr. Speaker, we have not given enough recognition to the heroes of our past. In the West, Sam Sharp, who led the Christmas Rebellion of 1834, has been recognized, and the monuments to his accomplishments have been laid. What was sought by the member from East Portland was that a similar recognition be given to Nanny, who was the heroine of the eastern end of the island. And in giving recognition to her, as this motion seeks to have done, we would not only be providing impetus to raise our own self-esteem as a people, but we would also be recognizing and implanting in the minds of the young the knowledge of the great accomplishments of the generations past. But it also has a very significant practical implication for the economy of Portland East and Portland in general. Because by establishing the Nanny Trail, we would have an opportunity to bring the great accomplishments of our own historical past to the attention not only of our own people, but to tourists who visit. Because we know, Mr. Speaker, that the history of Jamaica, as well as the present of Jamaica, is one of the most intriguing histories in the world and one of the most fascinating cultures in the world, which makes Jamaica, as a small country, have name recognition far beyond our size and population. And so, Mr. Speaker, what I think this motion embodies is a recognition that we need to make our own people more and more familiar with our own history. But it also recognizes that our history is of interest to the world, and therefore in helping to heal the wounds of our past and raise the significance of our own heroes, we can also give impetus to a new type of economic structure, a new type of economic approach, rooted in the real history of the Jamaican people, giving opportunity to the small businesses who have a place, who ought to have a place in the tourism product of our country, parallel and in fact perhaps even superseding the place of the big hotels and the all-inclusives. Because ultimately, Mr. Speaker, what this motion recognizes is that it is in the recognition of the history and the reality of the everyday Jamaican man and woman that we will find our salvation in economic, social, and cultural terms. And so, Mr. Speaker, I commend to this House the motion, private member's motion number 72, with the recommendation that Port Antonio Square be renamed Nanny Square in honor of our great national hero, and that the area between Breastworks and Port Antonio and Nanny Falls be renamed the Nanny Trail, because it is on that trail that she had some of her greatest military victories, which, although they occurred more than 200 years ago, they set the foundation for the independent Jamaica which we enjoy today. And therefore, Mr. Speaker, with your permission, I commend this motion to this honorable House in honor of Dr. Linvale George Bloomfield, former Member of Parliament of Portland.
Mr. Speaker.
Minister Montague.
Thank you, sir. Mr. Speaker, I too wish to join in the debate on this motion as one who has a little maroon blood in me. It would be remiss if I remain seated and not rise to support the motion. Mr. Speaker, the previous speaker rightfully detailed who Nanny was. And I believe there ought to be no division in this House in paying tribute to the person and to her legacy and to her worth in laying the foundation for where we are as a country. Many persons can draw on her story and find inspiration. And Mr. Speaker, we are remiss in this country of honoring our own. We are quick to honor others from other lands, quick to name things after them, and slow to recognize our own people. And in standing to offer support, I would like to expand that, because there are many persons across the length and breadth of Jamaica who every day do so much good in their communities, yet they remain unrewarded. Not that they are doing it for reward, unrecognized. Not that they are doing it for reward, but at the same time, it should be a beacon. There ought to be nothing wrong if each municipal corporation dedicate a wall in their capital city to even put the name of somebody, so that those who come behind us can find out why is so-and-so name on this wall. What's the story behind the person? So that we can value our own history and therefore chart a course for the way forward. Mr. Speaker, I will ignore the comments from the member from Clarendon. But Mr. Speaker, in naming the square and carving out the trail, it also has not only historic significance, but there can be economic benefits to the community. where tours can be organized, where the history and the value and the contribution of Queen Nanny can be repeated. Because if we do not repeat our own history, nobody will repeat it for us. And Marcus Garvey will tell you that if we are a people that don't know our history, we don't know where we're going. And therefore, Mr. Speaker, I want to commend the House for taking this bold step in not only honoring Nanny, but in also honoring Dr. Bloomfield, who served in this House. And I am very happy and hopeful, very hopeful, that we would have turned a new leaf in the direction of our country by being united on some issues. There are many reasons for us to be divided, but there are much more reasons for us to be united. If we are here to build a nation. And when Nanny was in the hills of Portland and St. Mary, she was not worried about a reward because she felt that the great reward would have been the freedom and liberation of her people and country. The struggle continues, Mr. Speaker, even today, because there are still injustices across the world and across the nation. And indeed, this step that we are making today is a positive step in highlighting and rewarding and celebrating, but it also will act to motivate, will give pause to those to come to honor. And therefore, Mr. Speaker, if it pleases you, I too would wish to support this motion.
Mrs. Neto. Tedley. Come into your reverend.
Mr. Speaker, I also would like to pay my personal tribute to the life of and memory of a giant of a man, Dr. Linvane Bloomfield. For me, a sweeter and nicer and gentler soul you could not have found. But beneath that humble persona, there certainly was a blazing fire and a passion for the people of Jamaica, and specifically the people of East Portland, who he represented here in the Parliament. It was this love and this passion, Mr. Speaker, his desire to see the human, physical, and economic development of Eastern Portland, which resulted in him tabling this motion we are here debating today. It is known by many that Nanny would have given her life to the struggle of our people. As members of this House, we should all be strong proponents of this kind of development, and as such, I'm expecting that this motion will pass with unanimous support. Nanny of the Maroons led a formidable battle between 1720 and 1739, which influenced our early movements towards emancipation as a people. Through her army, which was said to be one of the strongest, arguably stronger than her counterpart Kojo, her tactical skills and her strategy in war are her most talked about qualities. Mr. Speaker, the fact that she was a woman leading an army speaks volumes to her organization and her leadership skills. Therefore, her well-deserved honor of being named the only national heroine and being from Portland is only fitting that a national monument depicting her image and her work in Portland be erected. Mr. Speaker, my position in supporting this motion has been emboldened even more as a female parliamentarian by the fact that the resolution calling specifically for special recognition to be given for the life and work of our only heroine. This is important to demonstrate, especially to our females and our young girls, that women have been a part of the leadership of our struggles for self-determination and development and have not just merely played a supporting role. Mr. Speaker, Nanny was a military leader of the Maroons for the beginning of the 18th century, who was known both by the Maroons and the British as a symbol of unity and strength for her people during times of difficulties and crisis. All documented history. Mr. Speaker, it points to Nanny having exceptional leadership qualities. She was particularly skilled in organizing guerrilla warfare, carried out by the Eastern Maroons to keep away the British troops who attempted to penetrate the mountains to overpower them. Mr. Speaker, in recorded history of the British, it's pointed out how confused the British troops were by the guerrilla tactics employed by Nanny and her army, and the fear which the British troops had of the Maroon traps which were set. Besides inspiring our people to ward off the advances of the British troops, Nanny was also seen as a wise woman in a village who passed down legends and encouraged the continuation of music and songs which had come with them from Africa, and which instilled in them a level of pride and confidence as a people. Mr. Speaker, it is recorded that her fight and her desire for freedom was so strong, she disagreed with Cudjoe and other Maroon leaders for signing agreements with the British for a principle of peace, which Nanny knew meant another form of subjugation and would not result in the real freedom they were seeking. Mr. Speaker, there are many legends about Nanny among the Maroons. Some even claim that there were several women who were leaders of the Maroons during this period of slavery. But all the legends and documents refer to Nanny as the first Maroon war hero, as the most outstanding of them all. Her people, she led her people with courage. She inspired them through the struggle to maintain the spirit of freedom, a life of independence, which was their rightful inheritance. Mr. Speaker, it is clear that this motion is not only geared towards honoring the work and worth of our only heroine, but is also geared at utilizing our status to boost development for Portland, primarily through tourism. Mr. Speaker, Portland has built a reputation for being a heritage tourism destination, which has been built on an aesthetically beautiful environment and community heritage. The rich Maroon history which Nanny represents is a leading factor as to why tourists are interested in visiting many of the communities within Portland. Therefore, it would be in their best interest of growing the heritage tourism product within Portland to rename Port Antonio Nanny Square, and to develop the trail between Port Antonio and Nanny Falls to be aptly named the Nanny Trail. So, Mr. Speaker, in the spirit of Nanny of the Maroons, the Trailblazer, the glass ceiling smasher, for the liberation of our people, and in loving memory of Dr. Lynn Woolfield, who embodied that fighting spirit and strenuously represented for the development of the people of East Portland, I unreservedly and without hesitation fully support this motion. Thank you.
What she may give you, go ahead. Ms. Hannah, you want to? Go ahead, Reverend.
Thank you, Mr. Speaker.
Then I have Mr. Vaz and then Ms. Hannah.
Mr. Speaker, if you look at the histories written by Richard Hart or Beverly Carey or Sherlock and Bennett in respect of the period of history when Nanny of the Maroons lived and struggled. There were a number of particular issues that bear relationship to this motion. First of all, she defied the logic, the social and political logic of the time by, as a woman, becoming a military leader. Secondly, interestingly, the historical reports indicate that she was of gentle and restrained speech, but most effective in strategy and action. And thirdly, do you know the reason that she objected to the peace treaty that Cudjoe signed and other Maroon leaders? Was because it contained a provision that the Maroons henceforth would return all runaway slaves who came into their territory to their owners, and in that regard perpetuate the hegemony of the rulers of the country at the time. Mr. Speaker, I don't think I'm stretching things, by comparing in these respects our departed colleague, Dr. Linvale Bloomfield. He was a most unlikely representative. He defied political logic by being in this House. He left the certitude of private medical practice and all its preferences to the fevers and caprices of representational politics. He was a man of mild words, but of pointed resolve and effective action and representation. Mr. Speaker, very often we confuse gentleness with weakness, Dr. Bloomfield, by any account, was a gentleman, but no one could consider him a weak person. Nanny's struggle was an expression of resistance and strength. Bloomfield's struggle was for dignity and identity and progress for the people he represented in his parish. He wanted to use, and wants, even as his spirit courses in this chamber, though his body we are bereft of, he wanted to use history to energize the people, to give them hope, and to rivet them within their historical identity. Port Antonio, the site of the future Nanny Square, is no longer to be considered some kind of ersatz tourist town or forgotten banana port, but rather with a transformed identity given by this resolution, envisaged as a place of dignity, of memory, of history, instigated by a wise representative. And I'm hoping, Mr. Speaker, that within the various accoutrements of the Port Antonio Square and the soon-to-be renamed Nanny Trail, that somewhere will be found to be named after or a memorial placed for Linvale Bloomfield. And I'd like to join the sentiments of the Minister of Transportation and other things. Because, Mr. Speaker, we memorialize the identities of those who nobody remembers. Who is Maresca and Caledonia, Mr. Speaker? And in each town and constituency of this country, we have these archaic names that we hang on to without consideration when, as the member aptly said, there are people who have given effort, struggle, and substance to our lives, and who need to be explained and remembered and memorialized, not least by naming something after them. Mr. Speaker, for a long time, just to give one example, we have been making the effort to have Great George Street in Allman Town renamed Marcus Garvey Boulevard. He represented Allman Town in the corporation for a while before he was dispensed with. And who, with the greatest of respect, who is Great George in our value system right now? Surely we must use the influence that we have in order to ensure that we embody our history rather than his story. And in this motion, a singular and splendid effort is being made in this regard. Mr. Speaker, there is another motion that is not being taken now, also in the name of our departed colleague, in which the clarity and simplicity of his viewpoint called for particular attention and allocation to be made for the care of rural roads, the bushing of the verges and overhangs. It betrays the same and bespeaks the same avidness, the same attention to detail, the same concern for the ordinary lives of the people he represented. And I am hoping that we will find a way to take that also and to give it our fulsome approval. We have used a simple matter, an issue that has escaped the attention of the House for so long, but in the mourning and grieving for our colleague, memorialized, one may say, far more in his passing than in his life, we are, in fact, able to give tribute, and therefore all of us wish to support this motion. Thank you very much.
Mr. Speaker.
Ms. Hanna.
Thank you, Mr. Speaker. I rise to not only pay tribute to my departed colleague, the Member of Parliament, former Member of Parliament for East Portland, but I rise to pay tribute to a woman who has inspired me for many, many years. And when I think about her and I read about her, a number of things jump out. When I consider that even before technology, car, telephone, this ordinary Jamaican lady, African lady, decided to walk miles from the hills of Portland in the east all the way to St. Elizabeth in the west to go and tell her brother not to trust the British. Now, if you can imagine at that time, somebody, anybody, walking from one part of the island to the other part of the island, that must have been a very formidable human being. And what carried Nanny at that time were the drums, because at the time, the slaves and the Africans had a way of communicating with their beng and with the drums. And there were definite signals that they used to use. So this is not an ordinary woman that we speak about. This is a woman who defied logic. She defied brutal force. She defied the exigencies and the horrific terrain on foot. And she defied, at that time, a military prowess that would have appeared much larger than her stature. But what also gives us who we are as a culture, in terms of even our music or food, and sometimes our young people don't recognize the influence that the Maroons had on our culture. Jerk, for instance. The reasons why jerk came about was because Nanny in her fighting and many of the Maroons didn't want the British to see the smoke that they were cooking with. The drums were another example of how the Maroons have influenced our culture. The dance, a number of our religions. And that was a reason why, Mr. Speaker, in about 2014, when I was the then Minister of Culture, we decided that when we were going to have our first, or put forward our first National Heritage Site to UNESCO, we were going to put forward the Blue and Jonkra Mountains. And the benefit of having that site was because it was called a mixed site, because of its cultural value. So when UNESCO actually evaluated the site, they not only looked at the beauty of the Blue and Jonquil Mountains, but they studied the maroons, because the maroons were what made the Blue and Jonquil Mountains exciting. And they had teams that came down and looked at the endemic culture that was carried on and promulgated by the maroons, not only the endemic species. And they recognized that the history of who the maroons were also what contributed to the history and who we are as Jamaican people. And so on July 3rd of 2015, UNESCO recognized the Blue and Jonquil Mountains and the maroons as our first mixed cultural World Heritage Site. And it really is a testament to Nanny. And so, Mr. Speaker, when we went up into those hills with UNESCO, and it is inscribed, that inscription is there, it is only fitting that we continue the tradition and the process of naming the square Nanny Square, because it falls right into the entire thought process and the plan for what East Portland and certainly Portland is as a community destination and an ecotourism destination, and for people to understand the history of who we are as Jamaican people. So, Mr. Speaker, I credit Nanny for a lot of the DNA that many of us as Jamaicans have, particularly our Jamaican women, in terms of how feisty we are, how unabashed our resolve is to have the answer no matter what. Because regardless of who we are or where we come from, as Jamaicans, we know the answer. And we are going to show you that we know the answer. And that is the courage of the Maroons that runs in each and every one of us. Whether by blood or whether by reading about it, all of us are influenced by Kodjo, by her other brother, Kwao, and by Nanny. And so, Mr. Speaker, I take great privilege in supporting this motion and saying that we should all support this motion today. Thank you.
Mr. Speaker, I rise to pay my compliments to the former sadly missing member on this important motion that he has brought. And indeed, with respect to all the details that are contained in his motion, which is fully supported by everyone, which I have no doubt will be approved unanimously by this House, I have to cite history and the reality of what we are and what it speaks to, far beyond the mere naming of a square or a corner. I rise because the motion speaks clearly. Be it resolved, we recommend that the Port Antonio Square be renamed the Nanny Square. I could extend that to the fact of this house we are in, because all my life I've spoken to what is called the miseducation of the Negro. I grew up in an era believing that Britannia ruled the waves. I was led to believe that the Anglo-Saxon was the one who really I owed everything to. And I could go on because I recognize that the history that relates to literature, writing, creativity, producing movies, etc., embedded in our mind things that are really not so. I could extend that today to say that if life began in Africa, then the images I have seen throughout my school years could not be true. And I say these things, but I will only really rest my tribute on the basis of something I'm very proud to be a part of. Because when I say the miseducation of the Negro, I speak to the fact that all of us here in this house today, and I laud Dr. Bloomfield for bringing this motion, will receive a book list going to school on which will be called the Concise Oxford Dictionary. And therefore I go back to 2009. April morning, when while flipping through the copy of the Concise Oxford Dictionary, Henry stumbled on the word maroon, and the definition he saw got his blood boiling. That very dictionary we spend our money on to tell the children to go to school on had this description: described simply as a person descended from a group of fugitive slaves in remote parts of Suriname and the West Indies. I haven't checked the current edition of Oxford Dictionary. However, the editor wrote to me and apologized to the country in order to have that removed. I go on to say I was greatly offended and insulted. It's a perfect example of the miseducation of the Negro. There was no account of the bravery of the Maroons who defeated the English. And I repeat that. The Maroons who defeated the English in their fight for independence. That was the first defeat of the British in guerrilla warfare in the world. I'm happy to say it's captured in a book called The Iron Thorn, written by Kerry Robinson. And I put this in the context, Mr. Speaker, because I repeat, we've allowed the miseducation. Our history has yet to be written properly. Our history has yet to be interpreted to move our people to the next level where Afrocentricity plays the most important element in what we do. I look across at my colleague, former Minister of Education. Where is the program that you and I all agreed on the teachings of Marcus Garvey, which should be right now in the basic schools of Jamaica, analyzed, interpreted to guide them in their Afrocentricity? For indeed, I maintain the Battle of the Iron Thorn, which is what it was called by the British, emphasizes, and which will speak to the aspect about returning the slaves. If you have a treaty and you defeat someone and you sign a treaty, you have to live up to the treaty, and the dignity and honesty of the Maroons is expressed in that. Because the British conceded defeat and signed a treaty which gave them the ruling over their land and their area. Perhaps the Afrocentricity and the Anglo-Saxon aspect of approach is afraid of some of those things. I must attach that in my fight for reparations. I must attach that in the reality that we ourselves must re-look at where we are and begin to look at how we re-educate ourselves. So we don't abhor each other and the blackness in us, but the realization that if life began in Africa, then we should represent more likely what the Africans and what the world needs. We would recognize that the English language is the economic language. But I pay tribute to Dr. Bloomfield, because what I have said, I repeat and continuously repeat, and which must be addressed in recognizing what the member meant. What the member meant must now be extolled in the fact that in your schools in Portland, we must begin to teach them of their, and I think it was said by some, we must assist them in recognizing the people who have forgotten, those who have contributed, and therefore recognize that it's not here today and gone tomorrow. Dr. Bloomfield's motion speaks very deeply. It speaks very importance to the challenges we face, and we must now, in our own way, rise to that challenge, begin to re-educate ourselves, because in a real sense, just as I discovered what the Maroons were being said to by the British, just as I confirmed that the editor wrote and apologized to the country, I hope that when I leave here this evening, I'm going to look on the latest edition. I'm going to see if they have lived up to their word. I'll reopen the case because they have apologized to the country. And perhaps we might look at other things that were explained to us in order to see who we are. And in tribute to Dr. Bloomfield, begin to act on these matters by ensuring the implementation takes place and the substance is continued by the real maintenance of the square, as Nanny would have liked it. And that the necessary funds will be supported by a government in a grant to that parish to ensure that the square is maintained in the kind of dignity and respect. Because I'm sure many of us remember the time that they will think. But if we look at Wakanda and all of these, you will know that someone can really take a bullet in their mouth and throw it back at you. Mr. Speaker, my tribute is paid with the realization that what we must do is emulate the request of the Member of Parliament, continue the process, and support it with the necessary funds that will make it look the way it should. Thank you very much, Mr. Speaker.
Mr. Vaz. Thank you, Mr. Speaker. I rise to support the motion by the late Member of Parliament Dr. Linvale Bloomfield, who, as we normally did in the course of our service to Portland, had regular consultations. So this is something that was raised with me, and I gave it my support when he raised it with me some months ago. Mr. Speaker, in supporting this motion and all that has been said with the speakers before me, I want to reiterate that it is one thing to come here and move this motion and support this motion, but with respect to Nanny, we would have to make sure that if this motion is carried and supported by the Municipal Council, which at present is 72, it means that the requisite infrastructure, the maintenance of the town, which we don't have such a good track record because of the lack of resources, the roads leading up to Nanny Falls in the Rio Grande Valley that have been under so much stress for so many years, and all that goes with it would need to be not only upgraded but maintained. So it is very easy for us to come here and to support the motion, and then leaving here we pass it, and hopefully Municipal Council supports it as we do, and then in the years to come it is absolutely a disgrace rather than what we are trying to do, which is to raise the profile of Portland and, of course, the memory of Nanny. So, Mr. Speaker, I not only support the motion here, but I commit to this Honorable House that I will use as much influence as I have to make sure that the Municipal Council will support this so that this can become a reality. Because in real terms, that's where the decision rightfully will be made after being supported in this Honorable House. And before I sit, Mr. Speaker, I take the opportunity again, and I would hope that the Leader of the Opposition is listening to me, and of course all my colleagues. We are doing this in memory of a man who served with dignity. And again, I'm making a plea and a call. Let us make him be buried in dignity. Let us refrain from the politics using the life of someone or the loss of life for political one-upmanship. Dr. Bloomfield was a dignified man in his private capacity as a doctor, professional, and as a politician. We all say that here, and we all have paid our tributes. So what I ask from every member in this House is that the same way that we pay those tributes in here, when we go out of this chamber and go into the field, that we carry the same line. And if we do that, then we would be truly honoring the memory of Dr. Linvale Bloomfield. Thank you, Mr. Speaker.
Dr. Phillips. Mr. Speaker, your countenance has changed between the time when I started this debate and now that I close. Speaker appears to be a younger man. Mr. Speaker, I want to thank all the members of the House who have contributed to this debate. I think it is clear that we are all of one view. We are of one view about the quality of the person who originally introduced this motion, that he represented his parish well, and that embodied in this motion is his striving for the advancement of the people of East Portland and his striving for the recognition of the history, the real history of the people of East Portland, and that they should be given once again ownership of the heroes and the heroines who allowed their survival through to this time. And in passing this motion, we honor him. I think it is also the case, Mr. Speaker, that we all support the view that as a country we still have not made peace sufficiently with our history. We have still not really recognized all those who sacrificed to bring us here. We talk about Nanny today. Recognition has been given to Sham Sharp. Maybe not enough recognition to Taki, who led the rebellion in St. Mary. Probably not enough recognition to Kwao and the other Maroon leaders of the 1700s. Maybe not enough recognition, certainly, to all that Garvey did. And there is a very real way in which we still need to make peace with our own history. But in time, I have no doubt that that will come. We need to recognize, for example, Mr. Speaker, that the struggle for land that is still with us today is a struggle that has been around for 180 years. It's a struggle for which not only Bogle died, but for which 600 plus of his colleagues in St. Thomas were murdered on the gallows. But still, their struggles remain our struggles. And we'll only really make peace with our history, not only by the monuments that we erect, but by removing the causes of injustice that they struggled against. And that will be the ultimate end point of making peace with our history that was at the heart of this motion which Dr. Bloomfield put before us. Because he was asking for the monuments, yes. He was asking for the square to be renamed, yes. He was asking for the trail to be renamed the Nanny Trail. But at heart, he was seeking a better deal for the people of Eastern Portland. In closing, Mr. Speaker, there is one observation, a final observation, that I'd like to make and to commend especially to the House Leader. I think what this motion shows us is that there is so much wisdom that is often embodied in the private members' motions that come to this House, that if we were to provide more opportunity for those motions to be considered and debated by this House, we would find more opportunity and more cause for our unification in the House and for the coming together of our views. in an earlier time, and to answer some of the concerns raised by the member for West Portland, this House passed a motion that the private members' motions that required cabinet action should be taken by the House leader to the cabinet. The terms of the motions considered by the cabinet, and then the cabinet decision be reported back to the House. In this instance, this motion will require some cabinet decisions. It will require cabinet decision regarding the naming of the square and recommendations to the municipal corporation. It will require the provision of funds for the upgrading of the trail, and it will require the provision of funds for the commissioning of the statue that is needed. And so, Mr. Speaker, in piloting this motion, I am requesting that we have this matter and the House's decision on this matter reported to the Cabinet with what I expect to be the unanimous support of the House for this motion, so that action can be taken swiftly to see the mission and the ambition of Dr. Bloomfield fulfilled in this matter. Mr. Speaker, I move that this motion be put to the House.
Those in favor?
In favor of what? Just a minute. The House leader has to draw your attention to whether or not you're going to accept or not. I have a very serious problem right here. I have no problem with the resolution. But what I would like to know, what provision there is in the standing order that allows a member who is not the mover of the motion to pilot such motion. I do not believe that there's any provision for that. Where this motion is concerned, what ought to happen is a member bring this back next week. But there's no provision. Speaker gave no such provision. There's no provision. Did he say that? No, he did not. There is, is silence of the Speaker? Hold on. There's no provision. I have no problem with, Mr. Speaker, I have no problem with the particular, you don't even know what we're talking about. You have no idea what we're talking about. It's above your pay grade. It's far above your pay grade. You're to be cutting cane here, we're not in cane piece. Mr. Speaker, I am saying by what authority this is done. Okay? I do not know of any section of the standing order that allows a member to pilot a private member's motion from another member. I have no problem with the private member's motion. I will support it under normal circumstances. But we must follow the law. We must follow the law. And in the first instance, it should not have been allowed. It should not have been allowed. What the Speaker ought to have done, they could have asked for it to be brought over into the other section, or some of the members move the private member's motion. But it is not provided for. I'm proud to be Grandmaster.
Mr.
Just a moment, Doctor. Members, members, the motion was, members, the motion was allowed by the discretion of the Speaker. I was not acting at the time, but given the observation made by a member from Southwest St. Catherine, I want to agree that standard orders really does not provide for this situation. But for my, yes, I would want to put it to the members, given the fact that, as I've said before, it was allowed by the Speaker himself. The observation made by Member Warmington, a member from Southwest St. Catherine, is a valid point, and therefore I would want to rely on the opinion of the House. So I would put it to the House for consideration, and I would ask the Leader of Government Business to.
Mr. Speaker, I have said in this House since taking my seat as House Leader many times that we are guided by a set of standing orders. Standing orders that change over time depending on the circumstances and the stage of our development in parliamentary affairs. If, for argument's sake, if we looked at the Bible, which is May's parliamentary procedures, we will find that there are many changes have been made, many things included that we do not respect. Things that the use of language that they agreed to use in England that we don't permit here. So there are changes. We are in a constant state of flux. Constant. Because that's the nature of development. Now, having said that, whilst there is no specific standing order to which we can refer, there is no specific standing order that prohibits it. As far as I'm aware. Now, in those circumstances, and this being our house, the people's house, we take it to the people then. And we say to the people, despite our regret for not having perhaps done this prior to the debate, let's not make the time an enemy of the circumstance. So let us ask the House to vote on whether or not it is prepared to ratify the debate that has the resolution that has been debated. So I move that the question be put to the House whether or not the House, a yes or no vote, is prepared to ratify the debate that has taken place and the procedures attendant thereto.
Those in favor?
For just a minute before you take it. Don't you think, I believe...
Mr. Warmington.
Just a minute. The member is speaking about maize and rest of stuff won't change, but the standard order has not changed. Not that I'll vote against it, but I believe what needs to be done. The member who tabled the motion is dead. So the member who pilots
the motion should substitute, I believe. Am I correct? Substitute. Look, man, I believe you cannot move. Just hear me now. You cannot move a motion. Just a minute, I'm on my feet. I'm on my feet. Mr. Speaker, you cannot move or approve a motion in a dead man's name. He's dead, that's why he didn't pilot the motion. Therefore, there should be an amendment to the mover that the member who pilots the motion name is substituted for the one who died. Am I correct? It's as simple as that. You just substitute the name of the mover, and I'm in full support, whether or not. I'm still on my feet. I am still on my feet. It has to be a point of order. It has to be a point of order. I'm still on my feet. It has to be substituted for the person who pilots the motion. I'm correct.
Mr. Warmington, Mr. Warmington, whilst I understand your point, I believe that given the fact that the House Leader has asked for the motion to be put to Parliament, I think we should proceed along those lines.
Saying, how can you approve something in someone's name who's dead? It's a simple stuff. There are times we make mistakes, okay? All we have to do is to move that the name be substituted for the person who piloted the motion.
Hold on, Peter.
House Leader.
Mr. Speaker.
Mr. Speaker. I agree with you. I would like to make it clear, however, that we participated in this procedure at the invitation of the House Leader, and I would like to thank him and the government for having agreed to the procedure that they did. I have myself witnessed on many an occasion in various resolutions a member taking a motion on behalf of either a minister or another member. It has happened on many occasions, no doubt. No doubt. It's not a contentious matter, and I seek no contention with you. Mr. Speaker, what we have here is an unprecedented occurrence occasioned by the brutal murder of a member of this House. What was being sought by the House Leader was to honor the memory of that member. It was said in the good book somewhere that the laws were made for man and not man for the law. And I believe the solution sought by the House Leader was an way it may not fit every element of the legal nicety with which I do not agree. But that is your domain. But it was intended to show a collective determination on the part of this House to honor the intentions and the memory of a fallen member of the House. And while I respect that the member from Southwest St. Catherine might have his own reasons to stand on the letter of the standing order, I would urge him to respect the spirit of the standing orders and the intention of this House. To find some collective goodness at this time of mourning. And therefore I support your ruling, Mr. Speaker.
Those in favor? Those against? Ayes have it.
Mr. Speaker. Mr. Speaker.
Mr. Speaker. Mr. Speaker.
House Leader.
Question. Mr. Speaker, now that the motion has been passed by the Honourable House, can we now be told what is the procedure going forward? Because the right to do such naming is vested in the municipal authority. So, no, but just to make it clear that it has to follow a certain procedure, so that the impression is not given that it is passed here and it is done automatically. Okay? Move, man.
Mr. Speaker, in response to the member's question, and I heard others saying it goes to cabinet, that's not the procedure. A private member's motion is referred to the relevant committee. That committee reviews the private member's motion and then make a recommendation back to the House. Only after that recommendation comes back to the House and approved by the House, then it can go to cabinet. Fagan, you don't even know the first letter of the alphabet, what I'm talking about. Talk about the Lord your God. That's the procedure. Read the standing order. Hold on, I'm going to finish. I'm on my feet.
You're still on your feet?
Yes, I'm on my feet. A member asked a question, I'm responding. Mr. Speaker, in reference to the question asked, it must be referred to the relevant committee of Parliament. That committee reviews the President's motion, then makes a recommendation to the House, on which the House will vote. If the House votes in the affirmative, then the House Leader takes it to cabinet. That's only then and only then it can go to cabinet.
House Leader.
Mr. Speaker, I ask for recommittal of the item announcements.
Announcements.
Also laid on the table of the House today is Ministry Paper number 10 of 2019.
Mr. Speaker, you're going to table, you know. Huh? You tabled it now. All right, Mr. Speaker, recommittal of notices of motion given orally.
Notice of motions given orally. Those in favor? Those against? Ayes have it. Mr. Samguna.
Okay. Mr. Speaker, I was very struck by the suggestion by the Leader of the Opposition that we really need to give the opportunity to members to debate motions brought to this Honorable House. Over the past few months, certainly since April, the whole year, we have sought to do as much work in this House as we can. And in that regard, Mr. Speaker, I am to advise you that as we are about to close this session, private members' motions, we took 35 such motions over that period. Since April, 35. Answers to questions. A vexed issue that arose today when we only have 3 questions on the order paper. We did 26. We answered 26 questions. And bills that were laid in the House of Representatives over that period, we processed 9. So I think it is fair to say, Mr. Speaker, that we have done honor to the business of the House over the past several months. Now, I beg, therefore, Mr. Speaker, to give notice that at the next meeting of the House I will move, be it resolved, with reference to the sessional joint select and select committees which are appointed in the current session of Parliament, and where these committees have not completed their deliberations, that in the new session of Parliament the House of Representatives be empowered to enable these committees to proceed with the issues referred to them from the stages reached before prorogation. Be it further resolved that the composition of all these committees remain unchanged except where necessary by further motions taken and approved by this Honourable House. And be it further resolved, with reference to the undermentioned motions which are included in the order of business in this session of Parliament, but for which deliberations have not been completed, that in the new session of Parliament the House be empowered to proceed with them from the stage reached before the prorogation. And I list items 1, 2, 3, 5, 6, 7, and 9, and 10 under government business. The Law Reform Amendment of Penalties Act 2019. Private members' motions number 1 to 35, and all matters referred to committees. The Terrorism Preservation and Designated Reporting Entity Attorney at Law Order 2019. The Pensions Superannuation Fund and Retirement Schemes. The compulsory the compulsory acquisition shares in Petrojam Limited Act 2019. Mr. Speaker,
this is now the standard. Everything.
Mr. Speaker, I further beg to give notice that at a later stage of the day, I will move for the suspension of the standing orders to enable me to take this motion.
Oh, the continuance.
The continuance. Yeah. I just outlined what will be continued.
Public business. House Leader.
Mr. Speaker, I now move for the suspension of the standing orders to enable me to take the motions, notice of which I gave earlier.
Those in favor? Those in favor? Those against? Ayes have it. House Leader.
Mr. Speaker, I now move that the motions be approved.
Those in favor? Those against? Ayes have it. House Leader.
Mr. Speaker, it is not intended to do any further business today. I therefore ask that you suspend this sitting sine die.
Those in favor? Those against? Ayes have it. Members, I want to remind you of the opening of Parliament on Thursday at 11 a.m. This Thursday at 11 a.m. ceremonial opening of Parliament. This House now stands, Honorable House now stands adjourned.